Still ahead on Spectrum Bay News 9, replacing a knee with a 3D creation hot off the presses. In today's In-Depth, we'll explain the new printing technology helping patients, and we'll hear from one of those recipients. Technology advancing the way we treat injuries, there is now 3D printing to make knee replacements. A patient and an orthopedic doctor talked to our own Dr. Randy Schuck about this customizable implant in today's In-Depth segment.
Joining me now is Dr. Brian Palumbo and his guest, or patient actually, Ed Kalust. Thank you so much for joining us today.
Oh, thank you. It's fun to be here.
Yeah, so Dr. Palumbo is a orthopedic surgeon with Florida Orthopaedics, and Ed has been on the other end of the receiving portion of what an orthopedic surgeon does. We have a lot of interesting pieces sitting here. We're talking about a 3D knee replacement today, which sounds actually really cool. So we're going to have to go into depth a little bit. But before we do that, Ed, why don't you tell us how you actually became the recipient?
Well, I'm a CEO and founder of MediWeight Loss, which is a large medically supervised program here in Tampa, and nationally we have 136 clinics. So I'm a very, very busy guy, and I had been fighting the knee replacement for at least 2 years, having actually at Florida Orthopaedic, Dr. Gasser was giving me cortisone shots and a substance called Synvest. And you know, I just hobbled along, and my two sons said, "Dad, you can hardly get into work. You've got to address the knee issue." So I began a research program, which took me about 3 months, and I looked at all the possibilities of the way knees are replaced. And I came upon a program which is really called ConforMIS. And what that does is it takes a 3D picture of your knee, your ankle, and your hip, and then they manufacture in 6 weeks a knee replacement that is exactly like the one they're taking out.
Hopefully not broken.
Not broken.
So they knew an improved version.
It's a much more improved version. I can attest to that. And so I decided that that was the way I would pursue it. Being from Boston, where it was really started, I wasn't aware that we had a surgeon in this area that did it. So I was going to have it done in Boston until one afternoon when I was at Florida Orthopaedic getting a cortisone shot. I went by Dr. Palumbo's office, and I inquired about Dr. Palumbo and found out that he actually did do this particular procedure. And I can tell you that I had that procedure, and within 5 days, I was up and walking with a cane. And within 2 weeks, I was walking without any assistance. And I am now in my 8th week, and Dr. Palumbo has just cleared me to play golf.
Excellent.
Yeah, so I'm really excited, and I'm very, very comfortable, and I know I chose the proper method.
Well, it sounds like a great outcome. So let's go backwards. Obviously, we have a lot of knee recipients out there. Not everybody's happy with their knees either. There's a lot of challenges out there, pain afterwards, the wrong fitting. Talk about this system here and how it's improving the process.
Yeah, sure. Conventional knee replacements generally are fabricated and made in a certain way to accommodate, the broad spectrum of knees. So there's certain sizes that the patient is measured for intraoperatively, and then that's the best size and fit is matched at that time, and that's pretty much what you get. But with ConforMIS, or a custom implant for that matter, the benefit is not just sizing. Of course, you're matching the patient's size, which certainly has its benefits. But even more so, there are other factors involving the geometry of the knee that really permit it to move more naturally and make the patient feel like they have their normal knee back. So it's somewhat analogous to a custom suit versus having, getting a suit off the shelf. Another analogy might be if you have your tires balanced, or if you don't have your tires balanced, you're gonna feel it as you drive. Well, with this, it's going to be much more of a balanced knee. It's going to behave more normally and hopefully provide a better experience, feel more natural, and provide a faster recovery.
Sure. Now it sounds like obviously made to fit is the best way to go with most things, because not one size fits all in almost anything. So we found obviously this would be a better play. Ed's agreed with us that that's a better thing for his outcome wise. Any downsides to it?
Really, no. I mean, the materials that these components are made of have been proven through research. The implant has now been on the market for 6 years. No untoward, issues. And any implant that you have on the market, you're always going to be looking for issues like, loosening, implant failure, for a variety of reasons. Certainly, this implant has been on the market now 6 years. Has good research backing it up, and certainly haven't seen any of those issues that we would be concerned about.
Sure. Now let's talk about the ideal patient. Obviously, we have the ideal patient here because he got better and was up and walking quickly and is out without any problems. But what type of candidate would be best for this, and who shouldn't have this?
It's certainly a discussion you should have with your orthopedic surgeon. I think above and beyond, the most important factor is an orthopedic surgeon who's comfortable doing the surgery with whatever implant that they prefer to use. But with this specifically, most patients are going to be a candidate unless they have a really severe deformity in which this might not be an option. But that's really something that a surgeon has to evaluate the patient both clinically and radiographically. But in most cases, this is probably going to be an option for the patient.
Excellent. All right. So obviously, Ed, you have been the spokesperson for yourself and for this. What would you say to the patient who's been putting off this for 2 years? How long did you put it off? Because you're worried.
More than 2, probably 4 years before I finally bit the bullet.
So motivate those patients to get a knee replacement and tell them how it feels afterwards.
Well, I can say that first of all, you have to develop a positive mental attitude about the replacement. It took me 4 years to do it, and I can now say honestly, I wish that I had done it 4 years ago. I have comfort. I don't have any discomfort. I had very little pain. As a matter of fact, I did not have to take any narcotics. I simply used Tylenol, and I was very, very comfortable with that. So I would say go do the research and decide which knee replacement you would like. I would never do any knee replacement other than the one I did. I believe in the scientific approach of it. I even believe the surgeon receives with the knee his surgical instruments, and then once he's finished with those, I think you just discard them.
Yeah, and that's the other benefit too. I mean, just also to point out, I think the fact that he mentioned having a positive outlook, it really does dramatically improve the patient's outcome, and it really does help. And he mentioned some of the other benefits, such as the custom jigs and instrumentation, which really do facilitate the surgery. They actually minimize blood loss because you're not accessing the femur, which generally causes more blood loss. So that's another benefit of the procedure.
Sure. Now, obviously, knowing what you want, knowing where to get it, knowing what the best thing for you individually, and then finding and researching not only just the implant, but the doctor itself makes a huge difference, plus follow-up gets confidence. So thank you so much for sharing your story. Thank you so much for sharing your experiences and obviously your expertise. Have our patients take a look at these. I shouldn't say patients, our viewers take a look at these and make sure that it's the right fit for them. Thanks so much for joining us today.
Thanks for having us.
Thank you. We enjoyed it.